Good morning, student. This is a lecture for reproductive health for nursing third year. Good. Today we are going to see sexually transmitted infection. As you remember, last time we have seen abortion and emergency reproductive health service. We have seen under abortion, we have seen types of abortion, cause of abortion, as well as a treatment for abortion. Under emergency reproductive health service, we have seen post-abortal care like both medical and surgical intervention, and emergency contraceptive service like counseling and emergency contraceptive pills. Good. So today we are going to see sexually transmitted infections. What are sexually transmitted infections? We will come to it one by one. Good. Sexually transmitted infections are public health concern because of 1. Their high prevalency, 2. Their ability to cause serious complications, 3. Their role in facilitating the transmission of human immunodeficiency virus (HIV) that cause acquired immunodeficiency syndrome. Epidemiology of sexually transmitted infection. It is estimated that annually more than 340 million new episodes of curable STIs occur in men and women aged between 15 and 49 years throughout the world. What is mode of transmission? There are major 3 modes of transmission. The first one is sexual intercourse. The second one is from mother to child. When we say from mother to child, it can be during pregnancy, it can be during childbirth, it can be during breastfeeding. And the third one is through blood and blood products. So don't forget. The most common one is sexual intercourse, but it is not only sexual intercourse. It can be from mother to child, it can be through blood and blood products. So these are mode of transmission, major 3 mode of transmission. Don't forget. Good. So let's see these sexually transmitted infections, their pathogens, and the disease they cause. More than 30 bacteria, fungus, protozoa, parasites, and viruses can be transmitted sexually. The main bacteria, let's see one by one. So the main bacterial infections are Neisseria gonorrhoeae, causing gonorrhea, Chlamydia trachomatis, causing chlamydia infection, Treponema pallidum, causing syphilis, Haemophilus ducreyi, causing chancroid, Calymatobacterium granulomatis, causing granuloma inguinale or donovanosis. So let's see them one by one again. Ophthalmia neonatorum, neonatal gonococcal infection of the eyes can lead to blindness, which is known as thief of neonatal vision. Syphilis, congenital syphilis, we can classify as congenital syphilis and adult syphilis. Congenital syphilis is important and a significant cause of infant morbidity and mortality, which is inherited from, it is genetic based, inherited from parent to the offspring. Adult syphilis, when we say it is acquired, it is not genetical, it is acquired, which can cause serious cardiac, neurological, and other consequences, which can ultimately be fatal. Chlamydia infection is important cause of pneumonia in infants, which is caused by Chlamydia trachomatis. Fungal infection like candidiasis or candidiasis, a common yeast or fungal infection caused by Candida albicans that inhibit vagina, mouth, and the skin fold where there are more amount of mucuses located, can be sexually transmitted and responsible for vulvovaginitis in human and inflammation of glans, penis, and the foreskin in men. The other is protozoal infection like trichomoniasis, protozoal infection of the digestive system and the genital tissues. The principal protozoal parasites are Trichomonas humanis. This is one of an digestive system causing dysentery. The other is Trichomonas vaginalis, is a sexually transmitted protozoal infection of genital tissue which cause vaginitis with a vaginal discharge in female and a urethritis with urethral discharge in male. So it has also been shown to facilitate HIV transmission. The principle of viral infections are 1. HIV/AIDS by human immunodeficiency virus, herpes zoster or shingles by reaction of varicella zoster virus, herpes by herpes simplex virus and cytomegalovirus, genital warts by human papillovirus, hepatitis by hepatitis B virus. Good. The most common sexually transmitted infection is HIV. So let's come to HIV infection and AIDS. Its etiology: HIV lentivirus family. Two genetically different but related forms of HIV are HIV-1 and HIV-2. HIV-1 is the most common, which is located in Central Africa, US, and Europe. HIV-2 is not as such common, but mainly located around the West Africa and India. On the basis of genetic or genome variability analysis, HIV-1 can be divided into three major groups or three major subgroups. These are HIV-1, M, O, and N. M means the main one, O outliner, and N is none. That means not M, not O. None when we say. So we can classify into three. Group M virus are the most common form worldwide, and they are further divided into several subtypes, clades, designed as A to K, A, B, C, D, E, F, G, H, I, J, K, up to K. Virus subtype differ in their geographic distribution. For example, subtype B is the most common form in Western Europe and the United States, whereas subtype E is the most common clade in Thailand. Currently, clade C is the fastest spreading clade worldwide, being present in Ethiopia and India. Ethiopia has HIV-1, which are M subgroup and the C subtype or clades. Good. Mode of transmission. The three major routes of HIV transmission are sexual contact, parenteral or blood and body fluid transmission, and from mother to child transmission. Good. From this, which one is the most common? Sexual intercourse, which is about 75% of all causes. From mother to child is the major cause of pediatric HIV/AIDS, in which you can classify as in utero, intrapartum, and postpartum. In utero, when we say during pregnancy, this is transplacental. Intrapartum means during delivery by infected birth canal, and the postpartum means after birth by ingestion of breast milk if there is cracking around the breast as the nipple. Maybe after birth again there is transmission. In utero, during the pregnancy or transplacental, still the studies are going on. It is not now, but simply we can classify as during pregnancy, at delivery, and after delivery. Good. Some other disease related HIV are like, there are special diseases which are related to HIV. Example like herpes zoster or shingles, seen in 20 to 30% of HIV infected people. Etiology: reaction of varicella zoster virus infection, usually indicated as modest decline in immunity. Lesions normally follow dermatomal distribution. Cytomegalovirus virus, disseminated disease, commonly affect eye and the GIT. Disease of GIT like candidiasis thrush oral cavity and or esophagus. Etiology, it is fungus, Candida albicans, occurs in patient with CD4 less than 350 cells per millimeter cube. Presentation, white cheesy exudates on erythematous mucus in the posterior oropharynx. Diagnosis, KOH from scrubbing show pseudohyphal elements. Oral hairy leukoplakia. Etiology, it is caused by Epstein-Barr virus and it is presentation is white fond-like lesion along the later border of the tongue and adjacent buccal mucosa. Diarrheal disease, among the most frequent symptoms of HIV disease. A wide range of agents can cause diarrhea. Bacteria, Salmonella, Shigella, Campylobacter. Fungus, like Histoplasm, Penicillosis. Protozoa, like Cryptospordia, Macrospordia, Isosporabelli. Virus, cytomegalovirus virus, HIV virus. Parasites, Stringloides stercolaris. These are some diarrheal diseases. They cause diarrhea. Respiratory infection like bacterial, pneumonia, pneumocystis jirovecii pneumonia, again pulmonary tuberculosis. They can cause, these are major 3 cause of respiratory infection. Interrelationship between HIV and other sexually transmitted infection. Is there the relationship between them? Of course, yeah. In person with sexually transmitted infections, the concentration of HIV susceptible cells and HIV infected cells in persons with STI HIV co-infection is greatly increased, thereby increasing the likelihood of HIV acquisition or transmission. It is estimated that ulcerative STI increase the risk of HIV acquisition by as much as 300 times per each unprotected sexual exposure. So the relationship is vertical. Where there is HIV, the estimation of STI increases more than 300 times. Genitoanal cancer, some types of genital warts caused by human papillovirus lead to genitoanal cancer. Cervical cancer is one of the commonest cause of death in human in developing countries. The bacterial infections are curable while the viral infections are not curable, but some can be controlled. Don't forget, the bacterial infections are curable, but viral infections are not curable, even if we can control them. Management of sexually transmitted diseases. Sexually transmitted disease management can be classified into different approaches. The first one is etiology approach. The second one is syndromic approach. Etiology approach, when we say it is accurate diagnosis, accurate treatment, proper use of antibiotics. It is a better way to diagnose and treat asymptomatic infections. Disadvantage is it needs lab support and expertise, expensive and time consuming. But when we say syndromic approach, using flow charts to manage a particular syndrome, offers accessibility and immediate treatment and is effective and efficient. Good. What's the advantage of syndromic approach? Treatment can be given immediately. Mixed infection may exist and may be addressed. There is no need for laboratory diagnosis and the treatment can be given by mid-level health professionals. For example, a man presenting with urethral discharge would be treated for both gonorrhea and chlamydia infection. In a person with a genital ulcer, the treatment would most likely be for SCVI and chancroids. Disadvantage of this is over-treatment with antibiotics, treatment overload. There is a risk of creating antibiotic resistance and decreased compliance. Drug cost, missed asymptomatic infection. Studies have shown that syndromic cause management of sexual transmitted diseases using flowcharts is more effective than diagnosis based on either clinical examination or laboratory tests. Good. The other is, in general, an overall approach to the management of a patient with sexually transmitted disease begins with one, risk assessments. Risk assessment, when we say sexually orientation in the practice, number of recent and current sexual partners, history of sexually transmitted disease in patient, recent history of sexually transmitted disease of the patient or partner, socio-demographic and other markers of high risk. The other is clinical assessment and lab test. So these are the general overall approaches. Sexually transmitted infectious syndromes. There are different complications and syndromes. What are the syndromes or signs symptoms here? Urethral discharge syndrome is there, vaginal discharge is there, genital ulcer is there, inguinal bubo is there, scrotal swelling is there, lower abdominal pain, and the neonatal conjunctivitis are there. These are some of the STI syndromes. What will be the complications? The most serious complication and the sequel, long-term consequence of untreated sexually transmitted diseases is tended to be in human and the newborn babies, including one, cervical cancer, PID or pelvic inflammatory diseases or salpingitis, fetal wastage or abortion, ectopic pregnancy outside the uterus, ectopic pregnancy, and the other related maternal mortality. One. The second one is it can cause infertility in men and the woman. The other is transmission of infection to the fetus and the infant, causing blindness and permanent damage to organs and the tissues, serious generalized infections and deaths. Considerable family and social problem may be created, so constitute a huge healthy and economic burden that accounts for over 70% of economic losses caused by ill health. The complications and the long-term consequence of untreated STI sexual transmitted diseases can be very serious in human, even more than men. These are the most complications. So please don't forget what are the complications and what are STI syndromes. These are quite different. What are the challenges? The following are some of the factors hindering or obstacles for effective prevention and the care of sexually transmitted infections. What are these factors? Hindering factors or obstacles? Many cases are asymptomatic, more inhuman. That's why the humans are coming to your health center or hospital after it is complicated. So it is asymptomatic. They don't know whether they are caused by infection or no. That's why it is very challenging. The other is reluctance to seek healthy care because culturally, in most of the cultures, the humans are afraid or they are frightened to show their genital organs to any person, or even including health professionals. That's why they will not come to health center. They will afraid, maybe no awareness at all, so they are reluctant to seek healthy care. The other is unavailability or unsuitability of sexually transmitted disease services. When they are coming to health service again, this even health service or health center or hospitals, maybe there is no availabilities. Maybe there is no what we call it room alone because they need maybe privacy. Maybe there is no individuals who are experts on this, who took a training on this one. That's why maybe most of the time there is no availabilities. The other is ignorance of sexually transmitted diseases, their causes, symptoms, cures, and the possible consequences, and prescribed treatment is substandard again. It has not as the standards. The treatments are substandard or below the standard when we say substandardized. So these are the number of challenges. So please don't forget, I will ask you, what are the challenges in preventing sexually transmitted diseases? At least don't forget these 4 or 5 challenges. Good. The other is alcohol and drug abuse. So what are alcohol and drug abuse? Overall course of one's life, drug use may be necessary for optimal health. Example, an infant require vaccinations. All drugs affect the brain of everyone. Using a drug interferes with the brain natural ability to produce chemicals, so-called neurotransmitters, by increasing or decreasing the production. Drug affect maturation process of adolescents, which produce harmful consequences. Different pattern of drug substance intake include, maybe it can be use, abuse, misuse, addiction. Drug use, accidental poisoning. Drug abuse, like driving while intoxicated. Drug misuse, drug overdose, maybe using above the dose. Drug addiction means dependency and days. Good. Substance or drug abuse. When we say substance or drug abuse, means it is a term used to describe the use of drug other than for its intended purpose or illegal manner. Example, the athlete who took anabolic steroids to increase or to enhance his or her performance. This is what we call it drug abuse or substance abuse. Commonly abused drugs worldwide are the mostly 3. These are alcohol, cigarette, and marijuana. So these are the most common. Don't forget. What are the major 3 widely used worldwide? These are 3: alcohol, cigarette, and marijuana. So these 3 drugs, alcohol, tobacco, and marijuana, or hashish, what we call it, are considered as gateway drugs. Mean drug opens the door to other more illegal and dangerous drug abuse, including the use of needles to intake the drug, such as cocaine and heroin drugs, which are very serious. The sharing of needles during the drug use can lead to HIV/AIDS transmission. Tobacco is stimulant used to calm stress. Alcohol is depressant used to cope or survive with stress. Marijuana is depressant, euphoric, and hallucinogenic used to forget stress. Marijuana, don't forget, is a drug prepared from Indian hemp plants. So this is mostly used for smoking or swallowing, also known as pot in some area. In some area, marijuana. In some area, hashish. And in some area, it's named as bang. Therefore, don't forget these 3: tobacco, alcohol, and marijuana. Which one is depressant? Alcohol. Which one is stimulant? Tobacco. Which one is used to forget stress? Marijuana. So these are the major 3 commonly used worldwide. So drug misuse means occurs when individuals has an appropriate reason to take a drug but does not follow medical guidelines regarding the use of the drug. It involves increasing the recommended dose of drug to achieve the intended effect without medical consultation that can cause adverse health consequences. Drug addiction and dependency. Drug addiction and drug dependency are terms that are used interchangeably to refer to drug use that has biological or physiological, psychological, and social consequence for individual who habitually or routinely use a drug. There are multiple explanations for addiction, including biological, psychological, and social causes. Addiction is progressive, which means it gets worse without an intervention that may include fatal consequences. This is addiction. Physiological changes is a phenomenon called tolerance, in which more of the drug is needed to achieve the initial effect of the first use of the drug. Psychological consequences include compulsive behavior and obsessive thoughts that are experienced by individual who is considered addicted. It denial or prevents the individual from recognizing the severe consequences to healthy family, job, finance, etc. as a result of addictive pattern of use. What are the 3 C's of addiction? 3 C's. What are these 3? C means the word started with C. One is control loss, the other is continued use or compulsion, the other is consequences too. Control loss means loss over what, when, or how much of the drug is being used. Continuous means such that the use of the drug is primarily focus of daily activities. They are focused on it in a daily, they should do it. That's what we call continued use. Consequence 2 means to health, family, employment, and the legal status adversely affect the quality of life of the individual and significant others. Therefore, the 3 C's of addiction means C. One C is control loss, the other C is continued use or compulsion, the other is consequence 2. These are the 3 C. Sign and symptom of addiction. Physical sign, tolerance, withdrawal, shakes or hangover. Interpersonal relationship, marital stress, lost friendship. Work habits, low productivity, excessive absence. Value system, involvement in criminal justice system. Thought processes, judgment and memory impairments, denial. Spiritual alienation, drug have become a good and nothing else matters. So these are some of the signs symptoms. Types of addiction. Addiction of the 2 types can classify into 2: chemical addiction and the process addiction. Chemical means any mood or mind altering substance, example drug including prescription, illicit or illegal. Process addiction means behaviors that are uncontrolled, habits that produce adverse consequences, example gambling or betting, eating, sex, internet, cell phone addiction. These addictions are sometimes unnoticed because they are accepted by society. So process addictions are using Facebook for a long period of time, using the internet. These are what we call process addiction. But chemical means drinking, for example, alcohol drinking. These are chemical addiction. Prevention and management of addiction. Prevention, it can be classified as primary, secondary, and tertiary prevention. Primary prevention provides educational to the general public. Secondary prevention target intervention in school and workplace for at-risk populations who have experiments with inappropriate drug use. Tertiary prevention means management or intervention in hospital. These are the major 3 types of preventions. Solution for addiction: save life, say no to drug, yes to a positive you. Positive attitude, it determines how far you will go and a good feeling about yourself. Positive mind, thinking that leads to a good decision making and the problem solving creates refusal skill when confronted with drug. Positive family and friend, support productive action and pro-social behaviors. All that is required is being open and willing to ask for the help. These are solutions for addictions. Help is available. Treatment works. Intervention at the primary, secondary, and tertiary levels should be available. Asking for help is the first step. Locating help is as near as the phone and is available in the local community and at the national level. Contact the local mental health and substance abuse treatment providers. This is all about alcohol and drugs again. So next we will come to each other with major harmful traditional practice worldwide, especially in developing country, especially in Ethiopia, in Somalia, in different areas. What are the major harmful traditional practice? Next we will see each other with this one. From today, what we have seen, don't forget, we have seen alcohol and the drug. What are the consequences of this? How can we classify? What are the most common drugs worldwide? Like we have said tobacco, marijuana, or hashish, we have said cigarette smoking. These are the most common. How can we treatment? What are controlling system? What are the 3C? What are the prevention, primary prevention, secondary prevention, and tertiary prevention? So don't forget this again. So the other disease we have seen is sexually transmitted infection. What are sexually transmitted infection? Is this sexual? It's only sexually transmitted? No. It's transmitted from mother to child again, from by blood and blood products again. And what are this type? And under this, please don't forget to focus on HIV infection. That's all for today. If you have questions, don't hesitate to write me on my WhatsApp. Thank you very much. See you next.